Hello, everyone. Good evening. Welcome to our event this evening. We're going to be meeting with and talking to Dr. Shekhar Challa. So welcome, Dr. Challa. Let me go ahead and introduce you first. This is Dr. Shekhar Challa. He is a board-certified gastroenterologist, currently practicing gastroenterology and hepatology. So for us regular people, that is the study of liver diseases. Dr. Challa has been a gastroenterologist for more than 30 years in Topeka, Kansas. He's the author of several books, most recently Probiotics for Dummies. Dr. Challa has been involved in many phase 2 and phase 3 clinical trials, and he's the principal investigator for KMC Research Center, which currently has 6 liver studies.
Thank you. Thank you very much for that kind introduction, Emma. And I'm super excited to be here.
We are too. So this is our live format. Welcome. We do have a couple of questions I'm going to be answering, I'm going to be asking, but we are going to be taking questions from the audience. So anyone who's out there who's joining us tonight, feel free to type your questions in and we'll try and get them all answered. So Dr. Challa, our topic tonight is fatty liver and NASH. Let's start with the easy question. What does that mean?
Wow, that's a loaded question, Emma. Well, fatty liver is denotes the deposition of fat in the liver. The presence of fat in the liver is called fatty liver. Several conditions can cause that. Alcohol is a common condition which can cause fatty liver. But for today's topic, I'm going to talk about non-alcoholic fatty liver disease. So when I say fatty liver, I'm talking about NAFLD, non-alcoholic fatty liver disease. You know, it's not uncommon to see fatty liver incidentally on a sonogram or a CAT scan, or when you're doing some testing because your liver tests are abnormal, and your doctor will tell you, oh, you have fatty liver. You know, over the years, we have realized this is not as benign a condition as we were thinking of, and fatty liver, which is NAFLD, non-alcoholic fatty liver disease, in 30 to 50% of the people can progress to a condition called NASH, NASH, non-alcoholic steatohepatitis. So when you have fatty liver, 30 to 50% of the people, over a period of time, there's a lot of inflammation and scar tissue. Scar tissue is called fibrosis. So when you have a lot of scar tissue and fibrosis, you progress to NASH, non-alcoholic steatohepatitis. And 20% of NASH progress to a condition called cirrhosis. Most of you probably heard about cirrhosis. So 20% of the NASH patients progress to cirrhosis. And 1% per year of these cirrhotic patients will get liver cancer. So 30 years ago, or even 20 years ago, we thought fatty liver, coincidental, don't worry about it. Not anymore. Fatty liver is not as benign as we thought, and it can progress to NASH and then cirrhosis. Emma, can you pull up this picture I wanted you to post, if possible? All right. So if you look at this diagram, left to right, healthy liver on one side, which can progress to fat in the liver, which is non-alcoholic fatty liver disease, or NAFLD, which can progress to NASH with inflammation and scar tissue. And extremes of inflammation and scar tissue, primarily scar tissue, is cirrhosis. So that is a diagrammatic representation. The stage 1, healthy liver to NAFLD to NASH, that part is kind of reversible. But once you get to cirrhosis, it becomes irreversible. Hope that answers your question, Emma.
Of course. All right. So the next question I have is, how many people in the United States are diagnosed with this?
A lot, Emma, a lot. 80 to 100 million people in the US have fatty liver, which means around 25% to 33% of our population. That's a humongous number. Now, again, this is early stage fatty liver. We will never know how many of them have NASH and how many of them will progress up until later in the disease. So, the point I'm trying to make is if your physician has told you that you have fatty liver, don't worry about it. Today, that is not the way to go. Today, we need to figure out where in that spectrum I showed you, you fit. And that's the most important thing. Thanks, Emma.
That is a lot of people.
Yes.
We're getting a lot of really good questions, but I have just a few more questions to ask, and
Okay.
I'm going to pepper in some of these wonderful questions.
Okay.
Tammy, I'm coming for that one. That's a really good question. Okay, so the big thing that I guess I have to ask next is what causes fatty liver or NASH?
So the commonest cause, the two common causes are diabetes and obesity. That probably constitutes most of the NAFLD. And again, remember, for people who have joined in late, I'm talking about non-alcoholic fatty liver disease. This does exclude, today's discussion excludes alcoholic fatty liver disease, which is a totally different topic. So the NAFLD or non-alcoholic fatty liver disease, fatty liver, the two common causes are obesity and diabetes. And as we know, in our country, obesity is on the rise, diabetes on the rise, and that's why close to 100 million people have it. Less common causes are increased triglycerides, decreased HDL, which is the good cholesterol, high density lipoprotein, and there may be some genetic predisposition too. Some folks with hypertension have a little higher incidence of fatty liver. The one thing I do need to mention is this is in itself a risk factor for coronary artery disease. So most of you know what are the risk factors for heart disease. Well, liver disease in itself is a risk factor for coronary artery disease.
Okay, so it sounds like we have a lot of factors that are playing into this.
Yes.
Talk to me about the symptoms. How would I know that I would have NASH or fatty liver or anyone?
You won't, Emma. Most of the time, I guess I'm used to the phrase, the commonest symptom is no symptom. If you have, followed some of our advertisement and articles about colon cancer, that is the phrase I say. The most common symptom is no symptom. That's true with fatty liver too. And here is why. Your liver has a lot of reserve capacity. 80%, 80% of liver could be damaged, but you will have no symptoms. So when you talk about liver disease with fluid in your belly, big belly, jaundice, confusion, you're talking about very advanced liver disease, advanced cirrhosis of the liver. So by that time, usually it is too late. So the point is, most of these people will have no symptoms till you have advanced liver disease. So again, one has to be proactive and figure out what to do about it. And honestly, the best thing to do is go to a gastroenterologist or a hepatologist, a liver specialist, and they'll figure out what to do, how to diagnose, where in the spectrum you fit. Healthy liver all the way to cirrhosis. Where are you? And that's how you diagnose it. You have to do some tests to diagnose it. And I
Okay.
guess Emma is going to say, how are you going to diagnose it?
Well, we can talk about diagnosis, of course. Okay, so this brings me to a question that Tammy brought up just a second ago, which is kind of along the lines of what I was going to ask. Now, I try to stay healthy. I go to my regular doctor's appointment. I get my regular blood work done. And if the number one symptom is no symptom, then how does a regular person, how do we know, and how do you diagnose fatty liver or NASH?
So that's a very good question, Tammy and Emma. So the thing is, most of the time we see fatty liver for one of two reasons. because they have no symptoms. First of all, Emma, you don't have to worry about it. I know you don't have any diabetes and you're not obese, you're young, so you're not a risk factor. So the one thing I don't want to do today is cause false alarm here. So a standard person who has no reason to believe they have fatty liver doesn't have to worry about it. Okay. But if you're obese, diabetes, if your liver function tests, if your doctor says, oh, your liver function tests are a little elevated, don't worry about it. Well, that's not the dictum. The degree of liver disease has no relationship to the elevation of the liver function test, meaning that your liver tests in the blood test may be only slightly elevated, but you could have cirrhosis of the liver, or your liver test may be very much elevated, but you may just have only fatty liver. So the liver function tests are no way to know how bad your liver disease is. For that matter, a sonogram won't help, a CAT scan won't help. They will help if you have advanced liver disease. You don't want to wait till then. So a sonogram showing fatty liver or mild elevation of liver function tests will need further investigation. So the question is, how do you diagnose whether you have just fatty liver, which is NAFLD, or you already have NASH? And within NASH, there is early NASH and late NASH, or whether you have cirrhosis, early cirrhosis, late cirrhosis. The only way to diagnose up until a few years ago is a liver biopsy. So the radiologist, while they are looking at the liver, after they numb their skin on your right side in between the rib cage, put a tiny needle and get a little piece of the liver, which the pathologist looks at, and then you will know exactly where you fit in that spectrum. All right. More recently, over the last few years, there's a new test called a Fibroscan. A Fibroscan is a specialized ultrasound of the liver, which is actually sending sound waves through the liver, and then it catches the sound wave when it's coming back. But also, so by doing that, it tells you how much scar tissue there is in the liver, which is fibrosis, and how much fat is there in the liver. It is too much fat, or is there too much scar tissue? Then you fit in NASH. Extremes of scar tissue is when you call cirrhosis. So a Fibroscan is a non-invasive way without needles to diagnose fatty liver. The big problem with Fibroscan is most of the insurances have not accepted this as mainstream. So most of the insurances do not cover Fibroscan. Because most of the insurances don't cover Fibroscan, most of the facilities do not have Fibroscan. We at Kansas Medical Clinic Research Center do have a Fibroscan. It's very expensive, but we have decided to bite the bullet and buy it more so because we are doing a lot of research in several trials, and because of that, we have a Fibroscan in-house. We believe we are on only one of the two Fibroscans in the state of Kansas, at least the last I looked at. So that's how you diagnose fatty liver, where in the spectrum you fit. So can't hear you, Emma.
Hello, I have another question. I have another question. This one's from Heather, and this also fits into the next question I was planning to ask, which is, how do you treat this? And Heather asks, how do you reverse NAFLD?
Okay. So treatment, reversal, unfortunately, there is no treatment. And that's where I guess our research center comes in. NAFLD itself is relatively benign. It's early part of the spectrum, right? You'd want to halt it or prevent it from progression. So if you have a known risk factor like diabetes or obesity, then try to get your diabetes under control, try to lose some weight, and hopefully it'll halt it or reverse it. But if you have advanced liver disease, it's tough to reverse this condition by just diet and managing your sugar. This has superseded every other condition as the cause of liver transplant today. So it used to be hepatitis C was the cause of liver transplant, hepatitis B and all, but because of the increased incidence of NASH and cirrhosis from NASH and advanced cirrhosis, because of increased incidence of diabetes and obesity, this has become the leading cause of liver transplant in several institutions. And yet, there is no treatment. So this is where pharmaceutical companies come in. There is a race to get to find the right treatment. 20 plus pharmaceutical companies in the world, and most of them are doing this research in the US too. Over 20 of them are working on trying to find a treatment. And what that means is they have to go through phase 2 and phase 3 trials. But, honestly, before that, animal experiments, phase 1, phase 2, phase 3 trials. We at Kansas Medical Clinic Research Center luckily have 6 of these trials going on. In fact, I believe we are the largest trial location in the Midwest for liver disease, especially fatty liver, NASH, and cirrhosis. So no treatment, but we have good news on the horizon. We still think it may be 2, 3, 4 years before we get approved treatment for this condition.
All right. So you mentioned a little bit about the research center. Tell me just a little bit more about that branch of KMC.
So KMC Research Center, we have a team of 9 of us, myself, my partner, Dr. Dadi. We have 3 nurse practitioners, Laura, Jada, and Michelle. And we have a superstar study coordinator, lead study coordinator, Susie. And then we have 3 additional study coordinators, Kendra, Alicia, and recently Kelly joined us. Combined, we have over 100 years of research experience. In addition, we have a surgery center right here on site. So some of these studies need some procedures where we have to look in the stomach to look for veins in the esophagus, so we can do that right here. And we have a full team of nurses helping us on the clinic side who jump in anytime we need a Fibroscan, blood test, and all. So, we are a to Z solution here. And anyone who is participating in research will be compensated by the drug companies. One is welcome to go on our website to see which 6 studies we are doing. I'm not allowed to say the names, but these are household names, the studies we are doing for pharmaceutical companies. I do have to blow our own trumpet. We have had national accolades for one of the studies we did. 400 centers in the country, not in the country, in the world, 400 locations. We are talking about Ivy League, Stanfords, Harvards, and everyone. But we still were number 3, and that's a huge plus for us. And I had to push that in. So
I love that you snuck in that little humble brag there about being 3rd in the globe. Did I understand that right? 3rd in the globe on one of the research studies.
Yeah. Well, if I'm not going to brag about myself, who is going to brag? But in all seriousness, Emma, I'm not bragging. I'm showcasing our research center staff. They are awesome. Every patient leaves here with a positive comment about our study coordinators or our nurse practitioners who are available to do the physical exams and all. And the other reason I had to put that in is whoever is on listening to us, they have no clue who we are, right? Some of them do because they are our patients. Some of them do because I've been here forever. But a lot of them may not know who we are, right? So how do they feel comfortable? I'm getting into their shoes and saying, who are these people who are claiming that they do research. Well, that's why I had to put that in. Not only our patients, but pharmaceutical companies are recognizing us as number 3 in 400 locations. So,
Well, no shame there. Okay, so I've been working with you for a while, Dr. Challa, and I talk to a lot of patients and prospective patients, and the number one thing that I hear is, are clinical trials safe? I get that question a lot.
mhm. Yes, they are very safe. And, most of you, if we were doing this presentation a year ago, most of you probably were naive to understand what clinical trials are. With COVID around, every day it's in the news, right? So clinical trial, clinical trial, clinical trial. So I'm going to explain the process in a nutshell what a clinical trial is. Yes, they are very safe because they are regulated by the FDA, and they go through phase 1. In phase 1 they are testing safety in humans. So these are human volunteers where the drug is being tested. So only after phase 1, after FDA approves phase 1, they get released into phase 2. And what is phase 2? They are trying to determine the perfect dose for the drug. So they have 2 or 3 doses figured out. So 2 or 3 doses and a placebo. So actually, if I was to go into a trial, I wouldn't mind going into phase 2 or phase 3, because phase 2, my justification will be there's a higher chance I'll get the drug and not the placebo. But we do phase 2 and phase 3 trials. When you come to phase 3, and again, phase 2 has to be approved by the FDA, the results, the side effect profile, and everything, and then phase 3. So if you are watching the news, Moderna, Pfizer, AstraZeneca have almost finished up with the phase 3 trials, and they're presenting to the FDA, and we're going to hear about it in the next couple of weeks. Similarly, when we do phase 3 trials, whatever trial it is done in large number of patients. So if there is a side effect which was not noticed, or if the results were skewed because the number of patients was not in the thousands, then phase 3 is validation. Validation that this drug is effective and it is safe. And then FDA studies it, and only then it gets released out into the market. The advantage of some getting involved in the trials is, let's say if you are in one of our trials, and a year later, Fibroscan and biopsy, if it shows the disease has progressed, meaning it gotten worse. So what happened? Why did it happen? Number one, you might have been on a placebo, which is possible in trials. Number two, maybe you are on the drug and it still progressed. So you have an aggressive disease. So some of our trials offer what we call open label trial. Means you have progressed. So when you're progressed, then they'll do open label, which means you will get the drug till it's approved by the FDA. So that is the big thing, especially if you have somewhat of an advanced liver disease, late stage NASH, or even mid stage NASH. If you are in a trial and it is progressing, then guess what? You may get into an open label, because I still think it's 3 to 5 years before we have a drug for NASH. I hope I answered that question correctly. So
No, absolutely.
and the other thing is you are advancing medical science too by participating in the trial. So the one big thing is, sorry to interrupt, Emma, but the one big thing is liver can regenerate. So even if you are 80% damaged, 90% damaged, I've seen people with whatever condition they had, whether it's hepatitis C, alcohol, end stage liver disease, which stopped the insult, and then 20 years later, they are living a normal life. So liver is the only organ in the body which can regenerate. So if you halt the progress, and most of these trials endpoint is reversal, means you're getting better, or your fat content is getting better, or your scar tissue is getting better. So the trials, the endpoint end results of the trial is going to be it's actually reversing it. So that answers the question. Some of these drugs, I bet you in 5 years we'll have 3 or 4 drugs uh, which will be approved by the FDA. Because, like I said, it's such a huge global market. If 100 million people in the US are there, can you imagine what the global market is? So the pharmaceutical companies are on a race, and there may be a situation 20 years from now we may have 10, 12 drugs for this condition. Remember, 30 years ago when I started my practice, for hypertension there were like 5 drugs. Now they are like, I don't even know, because I'm a gastroenterologist, I don't treat hypertension. There may be 50 drugs out there. Diabetes too. I mean, sometimes people show up and with a list of medications I have to look up and see, because again, there's no way one can keep on pace with all new medications being released for all new conditions. So I bet you in 5 years, maybe 10, 20 years from now, we may have double digit drugs out there. So,
Okay, so I have a comment that I want to share. It's really great. This one's from Jen, and I was just getting ready to talk about this. I get to see the research center staff and how much hope they provide the patients and how active you are in making sure they're successful. So Jen here, she just wanted to make a comment that she was excited to be accepted in one of the drug trials. Really excited to have you on board, Jen.
thank you, Jen. Greatly appreciate it. So,
But I wanted to just ask one more clarifying question here. Dr. Challa, how many years have you been involved in clinical trials?
I'm trying to figure out how old I am.
Yep.
I've been in practice over 33 years, trials over, probably 25 years or so. So, and I've probably done, this is probably my 30th clinical trial, 30. So,
That is crazy. Okay, I want to back up just a tiny bit and talk a little bit about the Fibroscan. And I know that the research center is offering Fibroscan to patients, and you had mentioned that it wasn't covered under insurance. So if you could kind of flesh that out a little bit.
So, one of the things we decided is as part of this program, and actually we started this before, is, there's so many people out there with this condition not covered by insurance. So for a short time, we will provide a no strings attached Fibroscan. Again, you don't need to be enrolled in any trial, but if you are the right fit, if you have hepatitis C, hepatitis B, alcohol, then of course you're not the right person to have the Fibroscan. But if you have true fatty liver, NAFLD, and then we'll provide a free Fibroscan, and we'll be glad to send it to your medical doctor. And again, I go back and say no strings attached. So,
Okay, I did get a question earlier from Kay. What's the difference between a Fibroscan and an elastogram?
it's more or less the same thing.
Great.
See, the Fibroscan is the real deal, but there are other pieces of equipment out there which probably do the same thing, but it's the Rolls Royce of checking how bad your liver is. That's a
Okay.
benefit to it.
I have another question here from Tammy. If you have a family history of NASH, at what age should you get a Fibroscan?
If you have a family history and you yourself have no risk factors, I don't see any reason to get a Fibroscan. If you have risk factors, then the first step is do your blood tests, make sure your liver function tests are normal, and perhaps a sonogram if you are worried about it. If you have a risk factor like diabetes or obesity primarily, then talk to your primary care doctor. If a sonogram doesn't show fatty liver, then you don't need a Fibroscan. So family history in itself doesn't necessarily predispose you directly. I understand there may be a genetic component, but again, diabetes has a genetic component, obesity has a genetic component, and it may be that. But if you are otherwise healthy, I won't worry about it. So,
All right. I have another question from Bob. Let's see, Bob, is age a factor for this disease and also for getting into the trial?
Not really. I think most of the trials have late 70s, 75 as the cutoff on the upper end, and probably 14 as a. It depends on the trial, it depends on where you fit in. But really, an average adult should have no problem getting into the trial. So.
All right, let's see. I have another question. So many questions that are coming in. And really, everyone, feel free to keep sending them in because we'll keep answering them all night long. Okay, so this one is from Yvette. How do we sign up to have a scan? And I feel like
That's your question, Emma.
Okay.
So I'll let you answer that. So.
Okay, so the biggest answer here is just reach out to the Research Center staff. You can go onto our website, which I'll put up a little, there we are, our website, www.kmcpa.com. We do have, at the end of the event tonight, I'm going to be posting some links about all of our existing current clinical trials. So right now, for this evening, we talked about NASH and fatty liver. And we have a lot of other clinical trials for GI, and we also have clinical trials for dermatology. So go onto our website. We'll be posting the link, and then you can also just reach out to any of our research center staff. The staff members are listed on the website, and Dr. Challa mentioned our awesome coordinator, Susie. So she would be your ¡1 girl to reach out to, and she'll get you scheduled for the Fibroscan.
And in all fairness, all our 4 coordinators are awesome. So Susie is the awesome mess because she's the lead study coordinator. So I do want to give a shout out to Kay. She's on, I just saw her name pop up with a question, and I can answer her question too. Kay has, I've known Kay for a long, long time. She had a liver transplant, I believe, 20 years ago. Unfortunately, her question is, why are liver transplant patients excluded from the trial? Kay, the answer is we don't dictate what are inclusion criteria or exclusion criteria. The pharmaceutical companies, they submit to the FDA that we are planning to do a trial on XYZ. These are the parameters, and that's how the whole process works. So we are given inclusion criteria and exclusion criteria, and those have been vetted by the FDA and the pharmaceutical company, and that is the reason. So I bet you probably in the next, once we have positive results in a couple of these trials, that may be the next thing they may want to do. Because for them to do a phase 3 trial in liver transplant patients, they will need, hundreds or maybe even 1,000 liver transplant patients. So I don't think they wanted to put it in the non-transplant versus transplant because that may skew the results. But once the drug is approved, the liver transplant or no liver transplant, it's fair game for everyone. So.
I just wanted to show Kay's comment here.
Oh, thank you, Kay.
Okay, let's see. I'm just going to dig through the comments here. While I'm digging through the comments, actually, Dr. Challa, we covered a lot tonight, and we're getting near to the end of our live event. So I'd love it if you could just give me a couple of bullet points, highlight of what it is that you covered, especially for those who came in late.
Okay. So I'm talking about non-alcoholic fatty liver disease for those who came in late. Historically, even up until 10, 20 years ago, when you see mild elevation liver function test or a fatty liver on an ultrasound or CAT scan, it was not uncommon to say, oh, don't worry about it. That's wrong. Today, we know a lot of these people progress to non-alcoholic steatohepatitis or NASH, which can progress to cirrhosis. And just by looking at a sonogram or liver test, you can't tell where you are. So it is not as benign as we thought it is. So get checked, go to a GI doctor or liver doctor, get a liver biopsy, sign up for a Fibroscan. You need to know where in the spectrum you fit. because by the time you, and the liver is got a lot of reserve capacity. So don't wait for you to get jaundiced or get abdominal distension, because that means 80-90% of your liver is gone. So that is the biggest message I'm going to give you guys. Fatty liver, increased LFTs, whether it's mild or high, no way to say how bad the liver disease is just by looking at these two. And our clinical trials are a good way to get access to treatment sooner. Although you could be on a placebo, but you are on a placebo, then a year later you could go into an open label trial. Not in all of our trials, but some of our trials. It's a very common condition. A lot of people have it. Don't ignore it. And the no symptom is the commonest symptom.
Okay, I see one more question I think I'd like to cover, and honestly, it seems like a really hard question, so I'm going to go ahead and put that up on the screen. Tammy asks, can you talk about the alpha-1 genetic disposition? I skipped over there.
So this has nothing to do with the fatty liver. Alpha-1 antitrypsin deficiency is an enzyme I'll keep it short and sweet. It's an alpha-1 antitrypsin deficiency. If you're lacking that enzyme, you can have liver disease, which can progress to cirrhosis. So when we are looking for causes of liver problems, one of the blood tests we routinely do, not routinely, but one of the tests we do, before we call it fatty liver, we want to rule out a lot of other things: hepatitis B, hepatitis C, alpha-1 antitrypsin deficiency. There's a condition called Wilson's disease. So we rule out all that by doing blood tests. So that's what it is. But that in itself is not anyway related to fatty liver, the NAFLD part of the fatty liver.
All right. I also wanted to show, Heather says, thank you for this informative webinar. We did have a good time. We did have a good time. Let me just say a couple of things before we wrap up. I just wanted to remind everyone, we do have a lot of clinical trials going on, not just about fatty liver and NASH, but fatty liver and NASH, we do have a lot of trials. So Dr. Challa does have a 10-minute long, more informative video on our website at www.kmcpa.com. So if you want to learn a little bit more about fatty liver and NASH and the different stages, Dr. Challa has a really wonderful video. So also, if you would like to participate in our clinical trials, go onto our website, reach out to our study coordinators, fill out one of the forms online, however you'd like. We are offering the free Fibroscan, so go ahead and do the same things. Just reach out to us and we'll get back with you.
Can I make one comment too?
Yeah.
Well, when you look at that video, don't judge me, because I have a long hair, because right in the middle of COVID, my hairdresser was out. So don't judge me on that.
Okay, we won't. Let's see. I don't think I have anything else. I do have another comment here I want to show you. Yvette's coming in for a procedure and just listening to you put her mind at ease. So it was a great night.
Oh, thank you very much, and I'll see you Monday, I guess. So.
Okay, well, let's go ahead and wrap it up. Like I said, I'm going to be posting some links after we're done in the comments. And again, just go onto our website and you'll be able to find all of the information about clinical trials and anything you'd like to learn about. Okay, well, we'll go ahead and say goodbye and good night. Thank you again, Dr. Challa.
Thank you, Emma. I appreciate you staying late to get this done. And thank you all for joining. And stay safe and mask up, please. Thank you.
Thank you. And again, that website is www.kmcpa.com. That's for you, Barb. What's the website? www.kmcpa. Okay, that was it. Thanks, everyone.
Thank you.